and my name's Kira, and I'm a volunteer here with Pre-Health Shadowing, PHS, and thank you all for attending. So let's get started with this. Let me just real quick. What's this? Okay. Hopefully everyone can see my slides. So I just want to say that we do have closed captioning for everyone to enjoy our sessions to accommodate all students, and this setting is available at the bottom of your screen. If you need access to enabling the transcript, please direct message one of our team members if you need assistance enabling. We are always looking for ways to be more inclusive or ensure our sessions are accessible to everyone. So please, if you have any recommendations on how we can improve, you can email us at info@prehealthshadowing.com. You can also save us as a contact, and that way we can stay out of your spam. We do have an email list, so you can never miss a session. That's always nice. I always love reminders. So if you want to stay in the loop, you can follow us. And I also have the social medias on my account. We have LinkedIn, Instagram, TikTok, and on our email list, you can go on our website and you can also look through pre-health shadowings information there. We have a lot of resources and availability for if you want to join in or view some of these sessions that we even have recorded. Those are also a part of YouTube as well. We have some wonderful opportunities. Oh, I should have said that first, but so yeah, again, we have our Instagram, TikTok, and X, which is Twitter. I'm still not going to get used to that, but that's another way to get involved or to stay in our loop is social media. So we host students from all over the world, and if you want to play a bigger part of our team, you can also join our website and go and look into our information. But a little question beforehand is, where are you guys all calling from? I'm calling from today, Los Angeles, California. I know a few people are kind of all over. Wow, the chat's blowing up. I'm curious to see where everyone's from.
Kyra, I just noticed that the slide is not moving. Does the slide is moving for everyone?
I'm still on the same first page.
Oh, interesting. Wait, let me reshare it.
Yep, that's awesome. We're seeing the current one right now.
Oh, what if I change the page? Can you see the change the page?
Right now is the slides. Where are you calling from?
Oh, it's still not showing it changing. Maybe I'll just keep hitting share. That'll be my workaround. Um, well, let's see this Oklahoma's, Virginia, Arizona, Georgia, Reno, Nevada, Washington. A lot of people from the States. I don't see very many international yet. Ooh, Canada. I love Canada. Eugene, North Carolina. Okay, let's keep going. Let me share this again. So if you're interested in being part of pre-health shadowing, you can go and register as a volunteer on our website. This will be 100% remote, although we do have some availability or opportunities for in-person things. If you want to go learn more about that, it's on the pre-health shadowing website. We have availability for people who want to start clubs or start fundraising, and that can be something that you can do in person. Oh, we still have a lot of people entering the waiting room. So move this. Oh, okay. So if you want to apply to join our leadership team, that's something that you can apply to, and it's 100% remote. You do join a group of people who all try to build up their leadership skills and their 100% volunteers. There are a few people who work with them, such as Nina, who and the founder of this program, which is something that I've found as amazing. So if you want to play a bigger part in supporting them, you can also join this leadership team. That. So here's a few of the leadership roles in PHS. Hopefully you can see this slide. It's going to be a little bit annoying. Hopefully you guys can bear with me. The available roles is in IT, grants, fundraising, video production, research program, recruitment, diversity and inclusion. There's also an editorial department head, and you can have the lead of volunteer communications. There are a few other ways that you can get involved, and there's even opportunities to create your own role within PHS, depending on if you find something that's a valuable asset to them. You can use the following link below to contact and join the team. It's an easy application, and so if anyone's even thinking about it, or even if it's an opportunity, you can always just try to reach out and see. You can also email at info@prehealthshadowing.com, and you can ask what we're all about and see if it's something that works for you. So if you want to play a bigger part in supporting us, we'd love for you to join our network of student volunteers and team members, and you can apply to be a part of that administrative team and lead the students in various projects. So something that we also have, or if you're interested in being a high school student, or if you're a high school student and interested in getting involved, we have a program called HTP, High School Training for PHS. This allows you to get in contact with college pre-health programs and get fundraising for PHS and organize resources for other high school students involved. You can also make your own group or club at your high school that involves getting leadership and healthcare education for pre-college learners and kind of interest in the pre-health field, so that you can get more training and ideas through that. And we do have a high school training program form if you're interested, on our website. Again, if everyone can mute themselves, that'd be great. So as part of our mission at PHS, we're promoting diversity. And in order to do this, we've launched an initiative to have monthly panels to celebrate different demographics in the field of medicine. So if you have a mentor, a professor, or professional that has inspired you, and you think that can contribute to these conversations, you can go ahead and nominate someone. You can do so by emailing info@prehealthshadowing.com, and you can also privately message one of the workers or the volunteers here today. They are also happy to do that. We should have had a link, but I don't know if we have a link. So if that link shows up in the chat, you can also go ahead and nominate them there. So getting close to the end of this. Lastly, if you can donate, that'd be great. We're a free nonprofit company, and so we humbly ask you if you can donate to the program. As you know, pre-health shadowing is completely student run, and we're working around the clock to keep this free. And accessible to everyone. So unfortunately, Zoom and our website are not free, so contribution would be greatly appreciated, even if it's $1 or $5, whatever you can manage. You can give pretty much anything, and that'll help us out a lot. If you're not financially able to, though, we request that maybe you send the link, or you can join or scan the QR code and send that to some of your friends or someone that you think can help support. Or even help benefit from the program. We're always happy to have more people to volunteer or more people to come and watch these sessions. So we greatly appreciate that, and so that we can have more opportunities such as this one and the volunteering. So if you have any questions throughout today's session, we encourage you to drop any questions into the chat, and we'll have our co-hosts go and ask them during the Q&A for you. There might be some opportunities for unmuting, but we are not guaranteeing that. Our team members will make note of all the questions in the chat though, and they will make sure to ask all of them during the Q&A. So take as good notes as possible. We'll be going over all of these essential things to take notes for, and then you can have a valuable insight into kind of some things that Dr. Pernar has to say. And then after this, there will be a post-shadowing assessment to verify your shadowing hours. And so after completing this video, you will be sent to an application or a link to the quiz, and then you can go through that and determine if you stayed focused. It should not be a hard quiz, and it does not take very long. For more information, they'll be available at the end of this, and we'll discuss kind of how that works. And lastly, if you can turn any of your cameras on, that'd be great. I see a few of you have your cameras on, which is amazing. This is by no means an obligation, but we always love seeing everyone's faces, and it makes it more interactive for everyone. So it does make us feel a little closer instead of, everyone being on a camera, which is kind of the case now. But I appreciate for listening to my talk, and I would like to welcome Dr. Luise Pernar. And thank you so much for joining today. You may share your screen whenever you're ready. We're excited to hear what you have to say.
Great. Well, thank you so much for having me. I will, in fact, try to share my screen. So let's see what happens. All right. Can you see a PowerPoint presentation?
Yes.
Yes.
That is relevant to this topic at hand. Yes. Okay, good.
Yes.
All righty. So, all right. So thank you very much for inviting me. I was under the impression that I was asked here to talk about my path to academic, to my position, which is as an academic, minimally invasive and bariatric surgeon at an academic institution. So by way of introduction, I have an MD, which I'll tell you about. I also have a master's in health profession education, and I currently hold an appointment as associate professor of surgery at the Chobanian Avedisian School of Medicine at Boston University. And one of my hats that I wear is as associate program director for the surgery residency. And I will tell you about how I got here, and hopefully this will be relevant for everybody. And I'm going to try to sort of touch on like a bunch of different things that led me to where I am today. So this talk is a little bit about like choosing your own path and like what, I don't know if you might all be too young to have read the book, What Color is My Parachute? But it's like about finding your way in life. And so I'm going to sort of outline for you how I got to where I am, because it wasn't a very linear path. So I'm originally from Germany. I was born in a small town in the north of Germany called Göttingen. And when I was about 6 years old, my family moved to China because my parents were building a company in Beijing. So this is actually where I grew up. And I did all my school in Beijing from the elementary school all the way through high school. And growing up, I had a variety of ambitions. One of them was not artist, but I was still able to manage to draw these pictures. So at various points in time, I wanted to be a teacher, I wanted to be a vet, I wanted to be a journalist, a psychologist, a doctor, and I didn't quite know where it was all going to go. But so I spent my time first at the German International School and then transitioned to the International School of Beijing, where, so even though I'm German and like that's my background, that schooling was all in English, and the emphasis very much was influenced from the United States. And ultimately, that is how I ended up applying to college in the States and decided to come to the States to study psychology. And so I went to a small liberal arts school outside of Philadelphia called Bryn Mawr, where I spent actually 3 years because because of the school I went to and the coursework I did there, I was able to finish a year early, and did a psychology major with a concentration in neuroscience, and then was a little bit unsure about what I was going to do next, whether it was going to be a PhD or medical school. And so I decided to think about it some more, and I took a year out to do research. And I'd first worked in New Jersey at a pharmaceutical company, which at the time was called Hoax Marion Roussel. And I did basic science. And then I joined a lab in Philadelphia. And in that time, it became very clear that I did want to go to medical school and not just get a PhD. And so in order to do my pre-meds, I actually went back to Bryn Mawr and did their post-baccalaureate pre-medical program, which is, if you're not familiar with what that is, it's basically a pathway for students who haven't gotten their pre-medical requirements in a traditional college experience. You can go and do all your pre-med stuff in a concentrated program. So Bryn Mawr offers this, but there are a variety of schools throughout the country who offer pre-medical programs. It's usually a year, seldom longer than that, and you do chemistry, physics, biology, orgo, all in the same year. It's pretty intense, but it's great because you're there with other people who are who've already been out to do other stuff, and everybody is there kind of like to regroup and prepare themselves for medical school. And then because I was already sort of like off the traditional pathway at this point, and I wanted to really put together a thoughtful application, and since I was also an international student, there was some nuances around like how one would pay for medical school. And anyway, so I just felt my ducks weren't quite in a row. And I ended up taking a research position at Children's Hospital in Philadelphia. Again, doing again basic science, looking at the at fundamentally neurocircuitry underlying anxiety and stress. And I did that for 2 years. And if I want to tell you anything important today, it will be that whatever you do on your path to pre-health, make it count in some ways. And so during this time, the research that I did ended up leading to several publications on which I was co-author, and that I think ultimately really helped me in applying to medical school. I ended up going to Harvard, specifically the Health Science and Technology pathway, which is a collaboration between Harvard and MIT, where the curriculum focus is still very much anchored in the sciences. So the Harvard Medical School has two pathways. One is this, and then the other one is called the new pathway, I think, which is not new anymore now, but it's like been 20, 30 years, and it's a slight bit different. So anyway, so if you apply to medical school, you might apply to schools that have more than one route towards the MD degree. So just make sure you educate yourself about what those are. So at Harvard, I again was faced with a sort of choice, right? So what next? Because you go to medical school. I went to medical school actually to become a neurologist, but it became very clear very quickly that I didn't want to do neurology. And then I had to start thinking about what problems were interesting to me, what activities did I like, did I want patient contact? If yes, how much? What kind of patients did I want to take care of? What was the work-life integration possibility in different specialties? And
isn't that crazy?
Income is also something to at least think about when you're choosing a specialty. But after all was said and done, what really helped me in the end make a decision is my original interest in teaching and learning, because the one rotation that I did. So when you're in medical school, you do your preclinical work in the beginning, and then you go actually and do clinical work, and you spend between 4 to 12 weeks on a variety of services. So internal medicine, gynecology, obstetrics, psychiatry, surgery, and so forth. And what really interested me ultimately during my surgery rotation was the problems for sure. I liked the variety that you could be in the clinic and in the operating room. I liked that it wasn't always the same thing, but what really interested me was how residents learned to do what they did. And so that was what nudged me over into applying in general surgery. And I matched at the Brigham, which is one of the teaching hospitals affiliated with Harvard. So I didn't go very far, just basically down the street. So generally, so every residency program or like every specialty has its own training length. So something like internal medicine is 3 years, but surgery is a little bit longer. So it's typically internship, which is your first year, and it goes through postgraduate training year 5. But I ended up, after my second year, I went out to do academic development time. And I did my research time with a couple of excellent mentors. This is the second important thing I wanted you to take away from this talk today, that finding mentors who are aligned with your interests and who support you and who will like push you forward is incredibly important. And so I was very fortunate to work with Dr. Breen, who was the clerkship director at the time. At the time I was in medical school, and she's a colorectal surgeon, and she kind of like let me join her team, and we did a bunch of research together pertaining to the clerkship, but also resident education. In the middle is a picture of Dr. Sarah Perry, who is has a doctorate in education and focuses her work on surgical education. She was very helpful with design of studies and also with writing and editing. And then Dr. Smink, who's on the right there, he was the program director for the general surgery residency when I was doing my residency. He is also a surgical educator and a researcher in that field. And so I was very fortunate to collaborate with these folks. And I actually spent 3 years out in my research time, and again, tried very hard to make it productive, and ended up publishing on a variety of topics, both on sort of interventional studies, as well as more qualitative studies. And during the time out, I also did, to bolster my education in regards to research design and education, did several research training fellowships. So my role was the surgical education research fellow during that time. I got a fellowship through the Center for Surgery and Public Health at the Brigham to help support my work. And I also did specifically a medical education research fellowship during this time. So academically and otherwise very fruitful. And then I went back into residency and picked up in the 3rd year, and then did the last 3 clinical years. And basically what happens during residency is that you cover a variety of topics, mostly through the care of patients, but also through didactic lectures and self-study. And general surgery encompasses the care of the abdomen, breast, skin, and soft tissue, the alimentary tract, head and neck, the vascular system, the endocrine system, and surgical oncology broadly. And then also care of the patients who are critically ill or injured, so trauma patients. And what you learn in residency, again, through a combination of your hands-on training and also lectures and simulation, are the technical skills that you need to take care of patients and to actually physically do the operations that are part of the care of the patients. But you also learn a variety of non-technical skills, such as situational awareness, decision-making, communication skills, teamwork, and leadership. And these are all very important things. And because you do so many different things, general surgery residency ends up being 5 years for just the clinical training. The American Board of Surgery outlines what is required for certification. And basically, it's 54 months of clinical experience with at least 48 weeks of clinical experience per year. You have to complete several requirements. So one of them is advanced cardiac life support certification, which is the next step after basic life support, which many of you might already have done. Then it's advanced trauma life support, fundamentals in laparoscopic surgery. Since I finished my training, there has been the introduction of fundamentals in endoscopic surgery. So that's another exam you have to take. You have to be observed for at least 6 clinical and six operative performances, and you have to have a certain amount of operative experience. So the minimum number of cases or surgeries that you have to have participated in as a resident is 850, 200 of which have to be during your 5th or chief year, and 25 of them you have to have acted in as a teacher to a more junior resident. And so those are the requirements. And in parentheses, I've included for you what my experience was to sort of contextualize this a little bit. So I did 1,300 cases in my residency, 285 of them during my chief year, and 44 of them as teaching cases. So then after I finished, or as I was finishing, so because it's not finished when you're finished with your residency. So it turns out that, as I've showed you that wheel of what falls under the auspices of general surgery, there are a variety of different things you can do after you finish your residency training. And so examples are, cardiac surgery, thoracic surgery, colorectal surgery, trauma surgery, vascular surgery. It goes on and on. You can also certainly go out directly into training and start practicing. I did not feel that I wanted to do that or that I was ready. And the clinical interest that I developed during my surgery training was in minimally invasive and bariatric surgery. So those are two things that often go hand in hand. But so minimally invasive surgery basically just means surgery that you do without making large incisions, but just small incisions, and then looking inside the abdomen with a video camera to see yourself basically do the operation on a video screen. And bariatric surgery is surgery that is supposed to affect weight loss and also has metabolic effects, such as curing diabetes. So, and because most bariatric surgery nowadays is done laparoscopically or minimally invasively, those things often go hand in hand. And so the MIS or bariatric group in my training program, which all the individuals that are pictured here, I'm not going to go through them each individually, were part of that group. They're all inspiring teachers, excellent surgeons, just really a wonderful group of people. And they got me really interested in MIS bariatrics. And so I went to do my fellowship in specifically that, again, staying at the Brigham. So I did my residency there and then my fellowship. Fellowships are different length. So depending on which one you're interested in, it's between 1 to 3 years. MIS fellowship is thankfully 1 year, because if you're keeping count, I've now taken off 2 years after college. So 1 year after college, then 2 years after the postbac, then 3 years for research, and so it ends up piling up all the time I've taken off. But anyway, here I am doing my fellowship. Again, I did do research during that year, and this is also the year where I really started very seriously getting involved with some organizations. So specifically the Association for Surgical Education, as well as the Society of American Gastrointestinal Endoscopic Surgeons. So whenever you end up, going into your chosen career, there are going to be some kind of societies that are relevant to your interests, and it behooves you to join them. And you don't want to stop there. And I think this is where I was under-mentored a little bit early on in my career. What you really want to do is you're going to really get involved with the organization. So you want to present at them, and you also want to try to get on committees or start working with people in the organizations to help you continue building your career path. And that's really how you get your name out there, and can advance yourself. So after all this, it was finally time to find a job, and I ended up accepting a position at Boston Medical Center. And we're currently going through recruitment ourselves for our new intern class. The residency match opened in October. We're doing interviews now through January, and then the match is going to happen in March. And so I meet with a lot of people now, and so I find out a lot about them, and then I give them an opportunity to ask me. And the question that I get asked a lot, which I'm not sure how it's useful for the individuals, but it's neither here nor there. They often ask me, like, why did I take a job at Boston Medical Center, and why do I stay there? And frankly, the answer of why I went to Boston Medical Center is that it's on paper was exactly the job I was looking for. It was a bariatric as well as a general surgery position, with opportunity to do research, and clearly a path for getting involved with education, since it is an academic medical center. What I have come to really love about Boston Medical Center is the patient population we take care of. Boston Medical Center is a safety net hospital, which means that a lot of our patients are underinsured or uninsured. So we really serve a population that really has a lot of needs, so it's very satisfying to take care of the patient population. And then I think our trainees are excellent. Our residents are very, very good. And my colleagues in the surgery department are excellent. So a very superficial reason to take the job, but now lots of very good reasons to stay. Again, I think you always got to sort of think about, like, what can you do to push yourself forward. I did a couple of professional development things when I first started. I became the point person for doing peritoneal dialysis access. So I actually went to something called Peritoneal Dialysis University for Surgeons, which is kind of like a funny title, but it was actually very good. And then I did a faculty advancement program for early career faculty, and got some really helpful mentoring during that. And then just a few years ago, I did a certificate in applied surgical education leadership through the American College of Surgeons to continue to build my education portfolio. And as I was telling you earlier, but somehow didn't get back to, also during the first couple of years at Boston Medical Center, I got a master's in health professions education through the BU Avedisian Chobanian School of Medicine, because even though I had done a lot of my research was in education, I really thought that the master's would be helpful to just ground me a little bit more in the academic piece. Yeah, and so now what does my work look like? So I am busy in a variety of areas. So obviously this took many years to build, but so this is how I spend my time now. Clinically, I'm both a general surgeon and a bariatric surgeon. Within general surgery, I do a lot of different things, but primarily hernias, so groin hernias, abdominal wall hernias. I do gallbladder surgery and peritoneal dialysis access. And in bariatric surgery, I do sleeve gastrectomies, gastric bypasses, and revisions as necessary. I teach a bit. That's just part of my everyday, is interacting with medical students and residents, teaching them in the clinic as well as in the operating room. Then I do research, primarily in education, but also in quality improvement and outcomes as it relates to bariatric surgery and hernia surgery. And I have several administrative roles. So one of them is being associate program director for the residency. So I work with a team where we're under the auspices of the program director. And sort of the way that I view my niche is in program development and curriculum development. but I do some other things as well. But as part of that, I started a residence teacher program at Boston Medical Center and direct that to this day. At the time we launched this, it was kind of a new idea, but since then, a lot of other programs have started introducing this, and I think that's very good because residents have a very important teaching role, so we need to prepare them for that. And then I serve on a bunch of different committees. So within the department, at the medical school, but and also nationally. I'm like really excited about opportunities I've had to work with the American Board of Surgeons on a new program that is supposed to be the first step in moving surgery education towards a sort of competency-based model, and it's anchored in entrustable professional activities. And I also work with the Fellowship Council in reviewing fellowship programs. So again, those are the kinds of programs that train surgeons who finish their residency and now want additional subspecialty training. And my focus there is mostly on bariatric and minimally invasive programs. And during my time at Boston Medical Center, I've stayed busy. I continue to publish. Some years it took me some time to ramp up, and then now my clinical volume has also risen in parallel with this. So the last couple of years haven't been quite as academically productive, but I publish on residence teacher program, the variety of nuances on that, resident recruitment, and resident autonomy, specifically the roles of mentorship and how we develop skills, and then also some bariatrics and ventral hernia outcomes and QI stuff. I've put a bar graph in here to give you a sort of sense of my clinical volume. Over time, I've really tried to push from being sort of half general surgery and bariatric surgery to predominantly bariatric surgery. That's for a variety of reasons, but I was successful in doing that, and so you can see here that my volume really started gravitating towards sleeves and bypasses as time went on. I'm fairly busy. I do between 200 to 250 cases annually. You can see that the ramp up was pretty quick from the year that I started to now. So, and it's good to be busy. So that's fun. And specifically my week is divided like this. So on Mondays, I'm in the OR. Tuesdays, I have clinic. On Wednesdays, I have a clinic that goes into the lunch hour, and then I transition into administrative time. On Thursdays, I do research and again have some administrative time. And then on Fridays, I'm back in the OR. I'm in two different call pools. One is with the bariatric surgery team. I have we are 5 in my division, so we take call 1 and 5. And then I'm also part of a larger call group that does all the elective services at Boston Medical Center. And for that, the call is about 1 and 9. And as much as possible, we have these try to have these overlap. So, but on average, I'm on 1 in 5 days, and then 1 in 5 weekends. Beyond all this, I think it's important to highlight that life goes on even if you're busy. So I'm married. I have 2 kids. I love running. I've been keeping that up for the last ever since residency for the last 15 years. And I love reading. And I think that's having that balance in life is definitely very important. So I hope I was able to show you sort of how I got to where I am, and that it wasn't linear. It was a little bit of a meandering path. And I guess my pearls would be, there were some more in here. I think this picture didn't quite come out. But anyway, so my suggestions would be, follow your interests, sort of checking with yourself once in a while to make sure that you're doing what you're actually interested in. Then when you're trying to get things done, lead up, down, and across, meaning work with people who are above you to get things done, engage people who are who you want your projects to affect, and then get people on your team to work together. you got to set priorities, and then there was some other very smart stuff in here that somehow didn't show up. But this brings me to the end of my talk, and I'm very happy to answer any questions that you might have.
I don't think anyone has questions yet, but I have a few questions.
Yes.
Figured I'd ask them. You answered a few of the ones I was actually going to ask. But why did you think you went into surgery and specifically got more into bariatric surgery?
Yeah. So again, surgery was just kind of was the right mix of activities. So I like that you weren't always just in the clinic or doing like just a certain thing, but there was like always a lot of action. It was like you go to the clinic, then you go to the OR, and then you talk to consultants and you review images. And so it was very active. I like that. But I really was very interested in how the residents learn to operate, because you would see interns trying to do something and they could like barely tie a knot, but then a chief resident can do like extremely complex surgery. And like that path just fascinated me. And then when I was in surgery, the reason that I ended up going into MIS bariatrics was first of all like a group of very inspiring mentors, but I also really liked the bariatric patient population, because like the surgery makes a huge difference in people's lives, and you're taking care of what's fundamentally a healthy population. And if you can help with the obesity, then you can make them better. And I loved the conversations in clinic around eating and exercise. Like it just really like was interesting to me. Just when I was looking at my mentors, like at people that I work with, I was looking for a good life integration. And it seemed that that group particularly had it figured out. Like, so that's usually there are emergencies certainly, but for the most part, it's elective operations. And for the most part, people do pretty well, and it's kind of predictable. Again, there's lots of caveats to that, but I like that. I could not do trauma surgery. I've done it, and I'm fine at it, but that's not how I would want to spend my every day, because I find that very stressful. So I like this. It's like very like you can sort of have a long view of things, and I like that.
Awesome. Well, Tristan Douglas was asking if you had any study tips for the MCAT.
Oh boy, it's been a long time. Well, I think in general, when you're preparing for an exam, I think you got to strike the right balance between reading the material and doing practice tests. But I see this with our residents who prepare for their boards or their simulated boards, that they do practice test, practice test, practice test, which helps you take the exam, but it doesn't build knowledge. So you got to build the knowledge, and then you got to see if you actually are able to apply it. So you got to read and take practice tests. I don't know if I don't know, it's been so long, but they used to sell this like USMLE or MCAT like books, like they're like all you need to know for the MCAT. And like they're not joking, like it's literally all in there. So you just buy one book and read it and know it, and then that should pay off.
All right, and then I think Kim, if you would like to talk real quick, happy to have you ask a question.
Yeah, can you hear me?
Perfect.
Yes.
Okay, awesome. First of all, thank you so much, Dr. Pernar. I was curious, I noticed you kind of pivoted your research focus on a couple different occasions, and as someone who's kind of interested in thinking of doing that myself, I'm kind of terrified because I've been doing the same kind of branch of research for a couple of years now, and I think I'm starting to kind of lose interest in it. So how did you gain proficiency in a completely new, I mean, they were still related within the field of being neuroscience, if I saw correctly, but did you just ask to join a lab? Did you have to gain a different kind of certificate or training to become proficient?
Yeah, so the neuroscience research that kind of built off some work that I did as an undergrad. And then when I went out into the lab, like the techniques, like the postdoc showed me how to do some stuff, and then like my PI wanted me to learn something new for the whole group, and so I like kind of just read about it and was like, I'll teach it myself, and then I did. And then and that was all basic science, so I kind of like had a good foundation in that. The pivot was really making the transition to like the education research in QI when I went into residency. And I think really the hardest part, I think, of having to do a research redo is that when I was applying to general surgery residency, a lot of people were asking like why I wasn't going into neurosurgery or why I wasn't going into neurology. And I was like, well, that's not really that relevant. It's like, I'm not. And just because I've done this research doesn't mean like this is what I always want to do. So like convincing people that I really wanted to do general surgery, I think that seemed like the bigger hurdle. But then it was a completely different way of doing research. So it was like some of it was survey-based, some of it was qualitative, some of it was like, so it was a completely different way of thinking. So I really relied on my mentors in designing the studies. I read a lot of studies of the things that I was trying to do similarly, to see how people describe their methods. And then, as I outlined, I did several different fellowships, like mini fellowships, and then ultimately also the masters to really get a solid foundation in how to do the things that I wanted to do.
Awesome. That was a great answer. So our next question is Vincent. He said, how did you get started with research or find a mentor?
So when I did first, my research in undergrad started because we had to write a thesis to graduate. And because of what my major was, my thesis was bound to be on basic science. And then and I went to a very small liberal arts school, so it was easy to find a mentor because there was like one person who did one thing. So it was kind of like a gimme. And then when I got my first job out of college, I connected with someone. Like I just applied for this job at the pharmaceutical company, not really knowing anything about what they were doing, but it was neuroscience related. And I think that, they were like, oh, we can teach anybody anything. And they were correct. They could. And then the lab I joined at Children's Hospital in Philadelphia, that was through connections through my mentor. So I think it all goes back to you got to find good mentors. And now, how do you find a good mentor if you don't have one? I think that can be a little bit tricky. But whatever institution that you're at or whatever city you're in, you should start by asking yourself like what it is that you want to do, like what kind of research, who you might want to work with, and then and this is uncomfortable, but like I've had to do this for a variety of different things. Is you just start contacting people, be like, hi, this is what I'm interested in. Can you help me out with this? And probably 90% of people will not respond to you, but someone will. And you should try to leverage your network, because even though you might not know someone who does exactly what you want to do, you might have a professor or mentor that you're already working with who can make a connection for you. And I think that will go a long way.
Awesome. Loved that answer. Leslie asked, what helps keep you motivated through all your years of research and schooling?
Well, I think I'm a little bit of a competitive person, but like mostly with myself. So I'm always like trying to be like, oh, well, what could we do next? And I try to push myself forward. And I think what also keeps me motivated is that it's interesting to me. Like I like being a surgeon because that's interesting to me. I think I like thinking about new techniques or new things to do. But the research is interesting to me. And there are like these like little rewards along the way, right? So like you publish a paper, that's rewarding. You go give a talk somewhere, that's rewarding. And then if you do it enough, then they promote you from like instructor to assistant professor. If you do that long enough, you get promoted to associate professor. So there's like all these like little nuggets along the way that keep you going. But I think at the heart of it, though, has to be that you're interested in it. And so that would be, as you're looking for the color of your parachute, find the one that fits. And it can change over time, right? So what interested me a lot in undergrad and then afterwards definitely is not what I do now. I would not want to do basic science now. That seems terrible now. At the time, that seemed great.
Awesome. And then Irishu asked how much a post-bac program costs, or if you suggest going a different route instead of a post.
Well, I think it really depends on what your situation is. If you are in college and you can do your pre-meds and you know that's what you want to do, you're probably better off just doing it because you're already paying to be there. If you have already finished or you're in your senior year and the ship sailed, then the post-bac, I think, depending on it depends a little bit also on what you need. Because if you need just like one class, then just take that one class somewhere. But if you really need a substantial chunk of the pre-medical program, then a post-bac is probably worth it. I was fortunate that I went to a post-bac program at my undergraduate institution, and so they gave an alumni credit. So like it was half price for me. But a post-bac program generally costs the same as 1 year of college.
Awesome. I think that answered that well. Desiree Karen said, is it something that naturally happens or were you actively looking when you found your mentors? Was it more natural or did you kind of put in effort?
Right. I think it was a little bit of both, and it sort of varied by timing. So when my sort of interest in surgery became apparent, and like the motivation for it in part being education, I at that point in time started speaking to Dr. Breen, who was the clerkship director, about both applying in surgery, and then when I ended up matching at the Brigham, having conversations with her about how what research I wanted to do, and so set myself up to go out for academic development time working with her. And then she connected me, like I obviously knew the program director, and then between the two of them, I got connected to Dr. Perry. So it was a little bit deliberate, a little bit network. And then, as I came into my academic position, part of the reason that I did the certificate in applied educational leadership through the American College of Surgeons was that I really felt that I was lacking in some aspects of mentorship. And I knew the people running the program, they're like very, like if you're like in this like little niche field of surgical education, they're very famous. So it was kind of like meeting celebrities. So I was like, well, I really want to do this program to meet these people and learn from them directly. So that was a very deliberate effort on my part to get involved with that program.
Awesome. I see that Anna Gray has her hand up. If you'd like to ask Dr. Pernar a question now, you can.
Hi there, salutations. My name is Anna Gray, and I'm currently a junior in high school. And as somebody who founded the Future Doctors of America Club at my school, I often get questions such as what specialties I'm interested in, etc. And I was wondering if it's a good idea to focus on a specific specialty now, such as orthopedics or podiatry, etc., or if I should wait until I get into medical school and do internships and such before I start investing myself in a certain specialty. And I apologize, I know it's been a while for you.
No, don't worry. I mean, this question comes up a lot because I work with medical students quite a bit, and what happens all the time is that people like change what they want to do, and like I remember changing what I wanted to do in medical school and in residency pretty constantly. So it is a totally normal thing. I think for the purposes of building your as you like sort of think about applying to medical school, one of the things medical schools will look for is what research you've done and what shadowing opportunities you've had and so forth. So at some point you're going to have to pick something to do. But I would, and again, tailor it to your interests, right? That might, but also don't get too wedded to it, because you might ultimately see something in medical school or later in residency that will change your trajectory. But it's probably I don't know, everybody's different, but to me, it's always kind of helpful to know like what the end game is. So when I was doing my psychology major, I was like, oh, like I really like neuroscience, so I'm going to do that. And then I think now I'm going to go to med school and become a neurologist. But then other things came up. But so follow your interests, but then don't close yourself up to other opportunities, would be my suggestion.
Okay, thank you. That makes sense. I appreciate your time.
Yeah, of course.
Tony Nguyen asked, how can medical students complete 2 residencies? Is it possible to pursue both primary care and neurology?
So there are a few combined residencies, and what comes to mind is family medicine and pediatrics, or internal medicine and pediatrics. If you something like doing primary care and neurology is a little bit unusual. Generally, unless there's an intentionally combined program, doing 2 residencies in sequence usually is probably something that people only do because they didn't like the residency that they were doing to begin with. So I would say that's unusual, but you in theory could do it. The challenge, the little bit of a challenge with applying for a new residency position is that you obviously have to go back through the match. There are very few residency positions that are offered outside of the match. And then, but I mean, it's doable, but it's a little bit unusual.
Yeah, I've also heard of neurology and radiology, neurorads.
Yeah, right. Neuroradiology is definitely a thing. Cardiothoracic, like that. There are combined programs, for sure. But doing 2 fellowships in sequence is probably not that common.
So Don V asked, what can you do to get more research experience, meet with mentors, or participate in extracurriculars related in medicine?
What can you do? Yeah, so right. So to do more research, you got to get research experience. So you got to find someone who will let you do research with them. What my very like biased opinion is that you should try to find something that actually interests you and then do that and do it well. I think doing one thing well for a longer period of time is better than doing like many things for brief periods of time, if that makes sense. But again, that is my bias, but that would be my suggestion.
I agree. I think that's
So
great.
getting more research experience in the same context. So obviously, if like your mentor is not helpful, they publish but leave you off papers, like that's not good. But if you have a good thing going, then just continue working with somebody to build a portfolio, rather than doing like a scattershot approach.
Okay, awesome. Well, Dr. Pernar, it is 6 o'clock PT. I know we should be closing now or soon. There are a few more questions, actually a good amount of questions. So if anyone needs to leave, they can. But if Dr. Pernar wants to stay for a few more, I'm happy to ask a few more. What would you like to do?
Yeah, sure. Go
You
ahead.
want to be mindful of your time. So maybe I can skip a few and I can ask a few of the ones that seem a little bit more different from this, because I know some of these have some overlap, right? So one person asked, actually a few people asked about high school, as a high school student, what volunteer opportunities or kind of activities should they be kind of looking to do to get into medicine?
Yeah, good question. So something medicine related. That sounds obvious, but so things like volunteering at a hospital as like so a hospital volunteer, uh, volunteering at a nursing home, volunteering in an intensive care unit to cuddle babies. um, I did volunteering at a needle exchange when I was between college and like applying to medical school. Um, so again, something that you might do for a longer time is again probably better than something you just do for like a month or so. Um, and there are plenty of opportunities out there. So whatever city you're in, see what medical centers or shelters or whatnot are around, and see if you can get involved. Food pantry is a good place to look, or food bank. Um, uh, yeah, and if a lot of these, a lot of organizations might have an opportunity for you to get involved with like leadership. I know that you talked about getting involved with the pre-health shadowing program in leadership positions. I think that's always a good thing to do too, because again, for the medical school applications, so like what shadowing you've done, research you've done, volunteering you've done, and like what teaching you've done, what leadership positions you've held, like all that will work in your favor.
Yeah, all great tips. I love those. And then I'd say we'll leave some room for two more, and then we'll kind of close up. One of the last ones or one of the second to last ones was, how do you find your work-life balance between residency and your surgical career, and then having your family? What do you think kind of balanced you there?
Yeah. So one of my mentors in residency said that there are three things in life. So there's work, there are your hobbies, and there's your family. And you can only do two things well. So you got to pick which two those are going to be. And I think at different times, different things will become more important. So obviously, before I had kids, it was like work and hobby. And then with kids, that emphasis definitely shifted. I think it gets a lot easier when you're not in residency anymore, because in residency other people are in control of your schedule. But once you're in your job, you can within reason take control of your schedule, and that makes things a lot easier. And I think generally you just gotta stay true to yourself and check in with yourself once in a while and be like, am I doing too much here, or am I doing too little there? And trying to find the right balance. And it takes a while to figure it out. But you got to do enough stuff for yourself that you don't burn out, because you can't help other people well if you're not taking care of yourself. So I think that's an important thing to keep in mind.
Awesome. And then my last question for you that was asked was, do you have any closing kind of tips of how to make someone a strong candidate or a strong doctor for their future?
Like at any stage or a specific?
Any stage, any advice that you'd give someone becoming a future doctor?
Yeah. Well, again, I think you gotta be passionate about what you do to want to do it well. And I think the most important thing is to keep the patient in mind and the patient's well-being. So that's gonna drive your interest in research. That's gonna drive your interest in reading, in staying up to date with what's going on. It will make coming to work more fun if you're interested in your patients. And so just centering the patient experience, and the frustrating parts of your job, like the computer system that doesn't work, or you can't get the interpreter on the phone, like those things are not that big a deal. So those you can get over, just if you keep in mind that the patient is really the one you're there to take care of.
Awesome. Love all of that advice. Well, Daryl, if your question is quick, I would be happy to end with a nice little hello.
Right. Thank you. Thank you so much. I am also an international student at a very small liberal arts school. and my friends and I, we are trying to get into medical school, precisely do MD, PhD, if um, God permits. So how can we become strong candidates as you did? Because it's quite impressive being an international student coming from a small liberal arts school and making it to that high. It's very impressive. If you can highlight key, uh, any key, what do we call it? Any key, anything we can do, like for especially for liberal arts school who are small and also international students. Thank you.
Yeah. Yeah, of course. So I think that the advantage of being at a small liberal arts school is that you're bound to know your professors better and your mentors. So hopefully they that will be an opportunity to really get involved with some impactful experiences, like impactful research, get directed towards the right volunteering opportunities. And it always this might sound extremely obvious, but do well in school. So so if your application is strong, it should stand on its own. Obviously, for an MD PhD program, that's like even more of a lift because they're going to be responsible for paying your way, as opposed to just medical school where you really pay unless you get stipends. So yeah, I think you just my advice was just be put your best foot forward in everything that you do. Try to do as well as you can in your studies. Try to do impactful research that's published, and have your mentors and your pre-medical office write strong letters of recommendation for you.
Well, that all sounds amazing. So thank you so much, Dr. Luise Pernar. We loved your PowerPoint. A lot of people said that they loved your visuals. I definitely loved your little analogies. I'm a sucker for analogies, and I think we learned a lot from your PowerPoint. So I'd like to just share my wrap-up PowerPoint, and hopefully the pages are going to work now. So we do like to encourage everyone to reflect on all of our presentations. So what brought you here today? What are your three major takeaways? Maybe make a note to yourself. And what do you want to learn more about? You can always email us and tell us your questions or what you also want to see in upcoming sessions, and we'll try to accommodate that. So we just wanted to reflect, and the reflection is not really required and you don't need to message that or email that, but it is something that we found that is a nice helpful part for people taking notes on these lectures to kind of make their reflections. So hopefully this page is shared. I'm just going to share it again just in case. So if you're interested in being a part of pre-health shadowing as a volunteer or someone who helps and works with their organization, we are a nonprofit. You can register as a volunteer on the website actually, and the opportunity is 100% remote. So if you want to learn more about that, you can get involved with our program. You can email. It is asynchronous volunteering, and you get certified hours through professional nominations, graphic design, and social media promotions. We're also accepting team member applications if you want to take on a more active role. Then we strongly encourage you to come help us and be here with us with our organization. Once again, if you're able to, we're humbly asking if you want to donate, or please consider a few dollars through Venmo or PayPal. It does cost money for the program to upkeep and run, and to make it so that it's free for all of you. Similar to what you did today, you just kind of logged onto a Zoom and you got to learn all of this information and ask your questions. So if you're someone who can afford that, that would be amazing. If it's something that's not possible for you, we're always happy for you to share our QR code or our organization with your friends or family, or people that are also trying to become a pre-med. This is a great opportunity for anyone who's looking to do that. And those who cannot donate, then they can always contribute to. You can volunteer, you can help out. It's always fun seeing more pre-health shadowing seminars and seeing even people that come multiple times to see the doctors. So for now, we'll move on from that. And let me share this again. So now we have the part that we've all been waiting for. So how do you earn a digital certificate for attending? So you're going to need to take your post-shadowing assessment. You go to the website and you find the professional course pages, and then you go to where you found the take this course, and you can go to and then hit next to take our quick 10-minute quiz. It's multiple choice and it's based on the content from today's session. You'll have 30 minutes per attempt to earn a 70% or higher to get the certificate. And we know that sometimes technology can be difficult, and for this reason, we allow 2 attempts to take the assessment. And if you run into any difficulties, you can always contact us. We're happy to deal with anything that pops up because we know that that's kind of annoying sometimes. We recommend waiting 30 minutes to an hour after the session to take the quiz. And there'll also be a recording of this session that we will post that you can also go and rewatch if you had any technical difficulties during. I saw a few people had Wi-Fi issues or that came in and out of the session. So if you missed anything, you can always wait for the recording and take the post-assessment through that. Once you've passed, you can click the Finish the Course button at the bottom of the page and download your certificate. Again, if you missed any part of this session or you want to go back and view other sessions, you can earn the certificates through all of our other sessions. You can go to the YouTube channel and watch previous recordings, or you can find them on the professional pages on our website. To take the assessments, you would just finish watching the video and then take the assessment right after. Be sure to follow us on social media. We're always happy to have you guys come and join. Every other week, we're hoping to have more sessions, and you can always look on the website and see when those sessions are going to be held. I know that we have a few coming up, actually. We have more than once a week, which is exciting. And we have a few doctors and a few PAs. There's also some dentistry sometimes and some vets sometimes. So if you have any questions, feel free to stick around and you can ask our student team. But don't forget to subscribe. You also have our email, and we're excited to, move around. So thank you for joining today, and please stick around if you have any questions. And this shadowing session is officially over, so we invite you to log off or stay and ask questions.
All right. Thank you so much for your time. Just a brief, I looked through the chat. There was some questions about PAs. I'm sorry I didn't mention PAs. The PAs are a huge part of our lives at the medical center. They're extremely important, help in the OR and in the clinic. If you're interested in becoming a physician assistant, that is, I think, an excellent career choice. But another question was about how do you get involved in surgery without the stress of being a surgeon? Being a PA is the sweet spot. So, so if that's something you're interested in, look into it. It seems like an excellent career. And thank you so much for your time. It was great to meet you all. Take care.
Yeah, we all appreciated having you here and your time and taking your time out of your day. I know it's pretty late over there now too.
Yeah. All right, we'll tuck in. Bye.
Bye. Have a good one. Good night.
Thank you so much.
Everyone's logging off. Did anyone have any questions for our program specifically?
We'll stick around for questions.
Yeah, we're happy to answer questions. Jane, someone asked where to find the recording. It should be under the professionals page, but it won't be uploaded till the end of this recording.
Can you hear me okay?
You got a lot of reverb.
Okay.
There's no big due date on the quiz or the post assessment. It's just anytime after you watch the video, you can also go and watch the recordings, and any previous recordings you can also watch those and take the quiz after that. But there's no strict due date, so